It's Dr. Jan Michelle Martin here from JMM Health Solutions. I'm a pelvic floor physical therapist specialized in obstetric physical therapy, which is basically physical therapy for pregnant and postpartum women. What I want to talk to you today about, oh, here's my pelvis. Hey, you guys got to help me name this, by the way, just so you know, because we got to come up with a nice name for my pelvis. But anyway, I wanted to talk to you guys today about perineal pain. So first of all, got my pelvis here. This is obviously a female pelvic model because we've got the vagina, we've got the anus. This area right in here where my finger is your perineum, okay? And oftentimes in women, after pregnancy, they will have pain in this area. And for just reason, because when you're pregnant and you're in labor, you know, there's pushing in this area as the baby comes out. So in about 74% of women, they're going to have pain here within a week of, after 1 week of birth. Typically it'll resolve in 1 to 3 weeks. And some of the things that women can do, take some sitz baths, just warm water rinse. There's some different types of bottles and stuff that you can use that really help. And I can post some below, or even cold compress. And typically the cold compress that I will recommend to most women is just get some sanitary napkins, put some witch hazel on it, put it in the freezer, do it with a bunch of them so you can just kind of whip them out and have them at the ready for whenever you need it. So that's a quick DIY way to do a cold compress. Typically, like I said, it'll resolve in 1 to 3 weeks. You've just had all that pressure in the area, you've just had some discomfort in the area, and this is completely normal. When women need to come to see a pelvic floor physical therapist is when they've had a 3rd degree tear or a 4th degree tear or episiotomy. And what that is typically most women will tend to tear right here in this region, the bottom of so these are the labia, and right in here, just under the vaginal entry, people will tend to tear right here. And that's normal. You might get a grade 2. They might tear a little below. When the tearing comes below here into this region, I don't know if you can see there's some nice little muscle lines and striations there. When it comes into this region down here, that's a 3. And when it starts to go through, this is your anus. So when it starts to go through this tissue, that's a 4. The reason why this is so important is once it gets here, that's into the anal sphincter, okay? And the sphincter is what controls the exit of feces. If you are having a tear in that area, then what happens, a lot of these women tend to have fecal incontinence. So you keep hearing about leaking, you keep hearing about urinary incontinence. Well, a lot of women after pregnancy have fecal incontinence as well, and they're unable to control the exit of feces like they usually should be able to, because this is compromised, okay? One of the functions of the pelvic floor muscles is they control the sphincters, and the sphincters kind of think of pipes. So, your water is typically off unless you turn it on, unless you turn the faucet on. And you go and you turn it, water comes out, you turn it off, water will stop flowing. And that's the same thing. These relax to allow, the sphincters relax to allow urine or feces to come out, and then they tighten to kind of restrict any flow of anything coming out, okay? And so we tend to lose control when the muscle and the tissues here in this area are compromised. So that's just something to know. Again, this is talking about perineal pain, perineal trauma. If you have any questions, please let me know. DM me or comment below and let me know your thoughts. Thank you. Take care.